Hello everyone, this is Alraies from SCAI 2022. With me is Dr. Daniel Levi. He's going to talk to us about his feature presentation about the Harmony valve. Dr. Levi, thanks for being with us.
Hey, thanks so much for having me. So, you know, as a pediatric cardiologist, we're really congenital cardiologists. We treat not only kids, but adolescents and adults. And one of the disease processes that's a big part of our practice is tetralogy of flow. And when the surgeons repair tetralogy of flow patients, they essentially do away with whatever pulmonary valve they had, and these patients are left without a pulmonary valve, so it's our job to get them one. Most of those patients have very large right ventricular outflow tracts that are inappropriate for most of the balloon expandable valves that we have. Harmony is a self-expanding valve that has a nitinol construct, and it's designed to pop open out of a catheter into the pulmonary position in these patients, even when they have really large outflow tracts. So the Harmony valve is, instead of a balloon expandable valve, which we're used to in congenital heart disease, this is a self-expanding valve. What the data that I'm presenting does is it takes all three versions of the valve. The early version, which was a TPV22, which works great, and that was in the early feasibility study, but it was a little too small to fit most of the patients with, most of the big patients with RVOTs. There was a CTPV25, which we now call the prototype version, which was discontinued because it had structural issues, but a lot of patients did get valves with that. And then the other clinically approved valve is called the modified TPV25 valve. So this abstract takes data from the early feasibility study, from the pivotal trial, and from the continued access trial, and looks at all the Harmony valves that we've put in after 1 year and says, hey, how are they doing?
Yeah.
And that's really the importance of this, because this is a new device that, you know, the sum of the patients that we're looking at is only 94 patients. So we really need to continue to look at these patients and see how the valve's doing.
And are these patients have different iteration of the valve? And did you follow them for a year? And so if this degeneration, if there's a failure of the valve, all these clinical symptoms?
Right. So, you know, the patients that we're following are patients that got any form of the Harmony valve. The longest follow-up was with the earliest valve, which was the TPV22 valve that has median follow-ups on the order of 5 years. The newest version of the valve that's now commercially approved is a modified TPV25 valve. Those patients have follow-up at a year. So what we did was we said, okay, let's just see how they're all doing at a year. And the results of the data from a valve functionality standpoint are very good. There's 96% freedom from any sort of significant pulmonary valve regurgitation, very low serious frame fracture rates, and very low perivalvular leaks, very low. But most importantly, hasn't been endocarditis, there hasn't been any sustained ventricular arrhythmias, and there hasn't been any mortality. So, you know, surgical pulmonary valve replacement is a really straightforward procedure for the surgeons, not always for the patients, that is performed with very little mortality. So we can't have a high mortality, and fortunately with the Harmony valve, at least at 1 year, we do not.
Absolutely. Well, very exciting studies, and looking forward to finding the final paper when it's published and presented. Please watch this video and others on the SCAI-TV. This is Alraies from SCAI 2022.